Colleen Hutchinson, and we are here at the 18th Annual Minimally Invasive Surgery Symposium at the Wynn Encore Las Vegas. I have with me today Leena Khaitan. Leena, it's great to have you here. Can you just take a couple of minutes and introduce yourself?
Sure. Well, Colleen, thank you so much for having me. It's really a privilege to get to talk to you and be with you here this morning. My name is Leena Khaitan, and I am at University Hospitals in Cleveland, Ohio, and I direct the bariatric surgery program there in our esophageal and swallowing center. And privileged to be here at MISS and talk during the foregut session and the bariatric session this
great.
week.
How would you describe MISS to people who have not attended?
You know, this is an amazing meeting.
Yes.
You know, Phil has really done a phenomenal job putting this meeting together, because it's a very, I come away from it feeling like it's a very practical meeting.
Yeah.
You know, where people who are in practice can come and hear from experts in the respective fields, whether it be colorectal hernia, foregut, or bariatrics, and hear how people do it. Of course, the speakers all share data, but at the same time, it's also kind of, you know, this is what works in my practice, this is how I actually do the procedure, this is my technique. And then, you know, sometimes there's debate amongst the speakers.
Yeah.
See, there's a lot of controversies in what we do, and people have no problem discussing the controversies, so that, you know, when you go back to your own practice, you can take those lessons home.
Yes, it's a very open forum in that way. And Phil has talked about how one of the greatest things coming out of it is the faculty really learn from each other as well throughout the meeting.
Absolutely. Yeah, I learned so much at this meeting. I've been in practice for 16 years now, and I still feel like I'm learning something every time I come to this meeting. It's fantastic. I mean, the panel that he invites are just phenomenal people, and so I love learning from them.
Great. What is the biggest challenge today facing female surgeons who are on an academic path?
You know, I think that probably one of the biggest problems for women in that arena is probably mentorship and finding the appropriate mentorship.
Yeah.
Because, you know, when you're trying to climb the academic ladder, the road is not always clear. There's not a clear path for you to follow. And so it's really nice to have people who can help you along the way. And it can be other women, it can be men, they can be people at your institution, they can be people at other institutions, people you meet through societies. And, but finding the right people to help guide you through that path is fantastic. Through my career, I've been really privileged to see so many more women who are in role model roles now.
You're lucky then.
Earlier in my career, I would say there were a lot fewer women in leadership and surgery, and this year, I mean, what a bang-up year for surgery, having the, presidents of so many of our surgical organizations being women.
It's fantastic.
And I think that the bar is really changing so that path will be easier for future women going into surgery.
Yeah.